We have we have a couple of retirees out there, younger retirees that think that if you retire with just 20 years of service, you should get fully paid medical benefits for yourself and your family. There's been some attention drawn to MESA and those benefits, where MESA is now in a recruiting and retention effort going to offer paid health care to those that retire in MESA. There are some different strings attached with that. They did that before. It was stopped in about 2009 for anybody who retired thereafter, but now they're bringing it back. It's not something that's going to be locked into their MOU like our benefits are, but nonetheless, there's a lot of attention drawn on that. We don't see that happening with the city of Phoenix because the city of Phoenix is much larger, has much larger costs. We have a pension deficit and so forth that the city's paying down. Sometimes we hear from retirees that, like, why don't we have 100% health care if I can retire, paid health care with all deductibles paid, all co-pays paid, and completely free for my spouse and my young children? Well, we've never been able to do that.
The grass isn't green on the other side. And if you talk to people that are being honest, the people that have left and come back, they'll tell you those stories. So just pump the brakes. It was brought up earlier about our benefits package. I will tell you, I don't know if we're ever going to be not in first place in that category, because there's not one city that is willing to put $2 billion up to have their employees have medical coverage for life. There's just not. There's not any in this state. We can hardly find any in the country. That is a huge investment that your city has made into you and your future. And if you haven't calculated that investment is well worth waiting to see what happens with the benchmark and being paid.
The Phoenix MERP benefit, that's negotiated into our contract. The city can't change it. They can't stop it. They can't amend how it's paid. It's locked into our MOU. We're the only employee group that did that. I just mentioned that I had Billy Shields put that into our MOU back in 2007. And the cops didn't do it. None of the other unions did it. We have it in our MOU, so that's a benefit that will continue on. I say it's not a subsidy because it's in our MOU. It's a contract benefit, so it can't be taken away from us unless we negotiate it away, and we're not doing that. So that's one of the things looking at for retirees, and one of our goals is to increase that MERP benefit. But, that's just something that's, kind of on our list that we want to try to do for retirees, because we know retiree health care is expensive, both on the Medicare and non-Medicare side. The city of Phoenix has a MERP benefit. It's been $202 a month for years. We've been locked into our MOU. We're looking at, seeing what the city can do to increase that amount. The health insurance plan is in a nosedive. It doesn't seem that it's going to be feasible for the city to dump money into that. So if we can get money into the MERP, get that MERP bumped up, that would be a big benefit to retirees. So we're working. PSPRS update. So the PSPRS system has 250 different employers in that plan. So think of it as 250 different retirement plans. And when I say retirement plans, it's broken into police plans and fire plans. So the city of Phoenix has 2 PSPRS plans, a police plan and a fire plan. So each one of these plans have its own individual valuation, which means based on the funding level is how much the city has to pay in a retirement contribution. So getting back to the valuation of it. So when you hear numbers tossed around, so I just want to make this clear. So PSPRS as a whole, when you hear PSPRS is like 68% funded, which is about where it is now, the city of Phoenix fire funding level for our little silo in the public safety retirement system is 46%, 46 to 47% funded. Okay, not a really good number, and I'll tell you, don't worry about it, but I do want you guys to know this when you hear this. The cops are not as good. They're about 41% funded. Now, the way that, that could be addressed is by making, putting more money into the pension system, and the other way is to change benefits. Well, they can't change benefits of existing members, but the new folks that are getting hired in are in a new tier called Tier 3. So the Tier 1 and Tier 2, and pretty much everyone in here is a Tier 1, you're going to drop off, eventually. So there'll be more Tier 3 people in the Tier 3 component. So the city of Phoenix's funding level will go up. But The funding of PSPRS as a whole went from $13 billion. I'm a trustee, one of 9 trustees on the board. I took Brian Tobin's place. I was appointed by Governor Ducey. I'm waiting to get reappointed for another 5-year term. But when I got on the board, the funding was about $13 billion. Now we're at $22 billion. And that increase happened for a couple reasons. Number one, a number of employers took money that they got from various sources and paid down their individual unfunded liabilities. So like, for example, Prescott went from, 60% funded up to like 95% funded. A number of jurisdictions did that. The city of Phoenix is about, $3.5 billion with an unfunded liability. So it would take a big, big effort to reduce that. They haven't done that, but I want to point out that you're guaranteed your pensions because of some really progressive thinking union leaders back in the 90s pushed for, where is it in there? 1998 Prop 100. It was a constitutional amendment that many of you that were on the job worked on. We had Senator Mark Spitzer, a Republican senator from here in Central Phoenix, pushed to get that on the ballot. It was a statewide issue, and it was had a double-digit approval rating over. Well, it was separation between the like 70% to 30%, something like that. It was a pretty high number as far as those that approved it. And what it essentially said is that put a constitutional protection against diminishment of benefits by an amendment to the state constitution, which means you are guaranteed your pension, even if the city of Phoenix has to pay 200% of payroll for every member that's in the system. So just be aware of that. And to file bankruptcy and drop out is not really an option, and is not going to happen. But just want you folks to kind of know a little bit of background about that. But what I want to do is talk about Don Youngward. He's president of the Tempe Firefighters chapter of Local 493. He's also currently vice president of the Professional Firefighters of Arizona. And Don was instrumental in the Tempe Firefighters pulling out of their city healthcare plan several years ago and creating their own healthcare plan where they were able to take advantage of the good health and get appropriate discounts and create their own plan, which is what our goal has been all along. We've gotten resistance from the city, but in order to do that, in order to have a good retiree healthcare plan, you got to have the active part of it. So Don has been a forerunner in this issue, got their healthcare covered as actives in their own plan, and also has now created a statewide plan as an alternative to both the city of Phoenix, an alternative to ASRS's plan through Blue Cross here in Arizona, who have strong relationships with, which is really important. Sometimes in the United Healthcare, 1-800 number chain, it's easy to get lost. With Blue Cross, we have direct contacts and lines to them. So I'm going to have Donnie come up and speak to you and talk about the PFFA healthcare plan and what it does. So welcome, Donnie. Thank you.
Thank you. As Brian said, we started a retiree healthcare plan. We are a pre-Medicare plan. We do not have Medicare supplementals yet. We are working on that. We've been working with Blue Cross Blue Shield does not offer group Medicare supplementals, and so that's been the struggle. But for those of you that are pre-Medicare, we do offer a Blue Cross Blue Shield plan, MetLife Dental, which is the Delta Dental Network expanded. We also, starting 2024, enrolled in with the medical is Public Safety Crisis Solutions EAP. So that comes with the new 2024 rates. They're all rolled in. So anybody that signs up for medical automatically gets Firestrong and Public Safety Crisis Solutions, which is your 12 visits, EAP visits a year. Or per issue, I think it is. And we also offer some other things, but they're not eligible to be taken out of your pension check. Those things are like vision and AFLAC products, stuff like that. We are a PSPRS qualified plan, which means we work just like the city plan or the ASRS plan. It comes out of your pension check. The pension pays us. They take your premium benefit out. So you are qualified for the premium benefit with our plan. In order to see our plan, you got to go to, and by the way, we're a Viva Trust, so we are a union plan. You do need a union number to get it. So you have to have an IFF number. If you don't have your IFF number, you can join the IFF's alumni Association. Doesn't cost anything.
Like to do is our feature presentation for today is once again Kenny Timms, who's going to talk about basically an overview of all the plans, both on the Medicare side as well as non-Medicare, and the availability of what his service is. He's been tremendous for us as far as helping out retirees, looking for other plans, value, both comprehensive benefits and lower premiums for those that want a more of a bare bones plan. He's been tremendously helpful. He's getting hit this time of year with open enrollment and Medicare issues, so emailing him and he'll give you his contact information here. So I'll get Kenny's PowerPoint set up, but once again, give Kenny a big round of applause for coming again this year for us.
Thank you. While Brian's doing that, I get to, he used to do this, now I get to. I admit I took the wrong test. The union does more for you folks than you can ever imagine. I'm a retired Phoenix police commander. The benefits that other city retirees and police department and fire who normally work side by side, the benefits they've negotiated for the retirees is so off the charts compared to what everybody else has. Everybody's jealous. Everybody wants to try to get it. And the city says, no way, we did that once. We're never doing it again normally. So the union does just a super, super great job of doing that. I mean, you get $90 if you're on Medicare. Rest of the city people get $30. You have that union trust money. I talked to the individual who was our plea president at the time. Like, how did you not get that? And he goes, Kenny, it was always a race to be the first person done with negotiations because you always perceived that you got the better deal. And he said, so Billy Shields just let us race to the, off to the track. And next thing you know, fire comes in after us and they got this great benefit. And we're going, wait a minute. He goes, I went back to the city manager and he said, nope, we'll consider it in 2 years. And after that first year, they said, no way are we going to do that. So kudos to the fire department. They continue to look after you. You hear Brian talk about continuing to make sure things get into the MOU documented. So give your union a huge, huge round of applause in what they do, because no one looks after their retirees. No one does anything like this. There's no other seminars, sessions, so really do thank them. Next question. How many of you were here yesterday? Oh, just one. There's only one who wanted a free handout. All right. Okay, Bruce. All right. So like I said, my name's Kenny Timms. I'm a retired Phoenix Police Commander. And I've been involved in this business now for about 14 years. I've been directly working with the fire department since, I believe, about 2018, helping them and helping you with your healthcare decisions. I also sit on the PSPRS Advisory Committee. I chair that. And I'm also on the ASRS Healthcare Task Force. So we get input as public safety retirees into the retiree plans. I also want to introduce my son, Eric Timms. When I first started, I had my daughter helping me. She's now a Mickety-Muck manager at Blue Cross Blue Shield. My wife's helped me. If you've emailed, she's the one responding back to a lot of those emails. And it's continued to grow, so I now have my son, Eric, helping me. He's also a licensed agent. In fact, he's licensed in more states than I am. He's gone through all the Medicare certifications. So one of the two of us this year will be helping you with any of your questions. This is here for Brian. This is a cop's dream. Putting out the fire, playing with the fire hose. So I just had to start it off with that. I never got to do that, but I have a fire hydrant in front of my house up in Sholo, and I'm hoping to get a fire hose so I can play with it, but we'll see. A couple of things I want you to keep in mind when we go through this. You have health insurance for two reasons. Financial protection. You don't want to go broke. You don't want to take everything out of your savings. You want to be able to pass it on to your kids. Or to win the battle for your life when that time comes. if we're not able to do both of these, then we have no business putting those products, using them, because you want to know that if something bad happens when the Grim Reaper comes up to get you, that you have every available opportunity to win that battle. So your insurance has to help you do that. Now, the big things that are new this year is, of course, the big increase to the City of Phoenix premiums, as well as no later than, and I use the word no later than, December of 2025, the under 65 retiree plans are going away, okay?
Pete, get on up here. All right, we talked about earlier some legends in the hall. Here's one of them, as you know, Pete Urias, former Local 483 president. Seen you in a long time. Boxer extraordinaire. Some of you can probably take him now. I don't know. Anyway, so Pete, like a lot of folks, was unhappy with high non-Medicare health care costs, so he's gotten himself into the insurance business here, and he's brought along one of his associates today to make a little presentation on non-Medicare. So if you welcome Pete and Jeremy today.
Thanks. Hey, I know there's a few of you who are just waiting around for us, and tomorrow we're going to try to get them before the Medicare, post-Medicare stuff, but he's right. What we did is, way back when, about a year or two before I retired, like Glendale was the final one, and Glendale was letting their firefighters go off. They were no longer eligible for medical health insurance. And it started happening around, and now you see even Phoenix is going to be doing the same thing in a couple of years. So what we did is we decided we're going to start our own because the guys that were getting let off the city health insurance, they couldn't even get group rates. And they had already done that in Bisbee or Globe, Douglas, a few of those places down in South Arizona. So we decided we'd start our own. Brian Willingham talked about, and I want to reiterate, the union is not sponsoring us. They're not sponsoring the ones that I started with Don Youngward, which is now the PFFA plan. We started that. It didn't quite do what we were hoping, but it's a good plan. It's an option out there. We got into this because we want to take care of what we've always done. Take care of the members, and while they're on the job, and once they retire, and then those that have yet to don the equipment. So he's going to go over some of the stuff, and we're
Available for a lot of people is, if you're under 65, how many of you are under 65? All right, the Affordable Care Act, those plans are a very, very attractive option if you consider the tax credit that the government will pay toward your insurance if you enroll in one of those plans. We're going to go now. Here's a billboard of all of your options for the most part. These are the current prices as of today. The PFFA, that's going up, I think Don said 3 to 5%, okay? They don't have their rates yet. Now, one thing to consider, and the PFFA offers you all of those extra benefits, okay? The cancer screenings, things like that. You have to factor that in. And you're gonna have to answer yourself, is it worth $330 more a month, $3,600 a year, times 3 years, which is it worth $10,000 because you get one cancer screening every 3 years? Or can you pay cash and make up that difference for that cancer screening, saving that money? Only you can answer that. My job here is to educate you how to do the math, how to make those decisions. Your lowest cost plan next year, option for retirees, is the Public Safety Retirement Systems, $660 for a single plan. That plan has an $8,000 maximum out of pocket. By the way, that's about the same out of pocket that the federal marketplace has, okay? Now, it does have some decent copays that make that worth it, but if you're getting a similar plan for $300 as a single, the ACA is going to be a much better option. The thin blue line, if you know you're going to use the benefits, it has a higher premium, but it has a lower deductible and out-of-pocket. I myself am personally enrolled in the Thin Blue Line value plan. It's my wife and I, $13.98. It would be $13.20 to go on the PSPRS plan. However, two things are going to happen. One, I can make changes every year, so it really doesn't matter. But I looked at the difference in premium for me. I said, you know what? It's worked for me. It had my knee surgery. It covered everything. I'll pay the additional money for a lower out-of-pocket. Okay? But if I was healthy, didn't need anything, then I might consider that state. Or I might say, hey, I want all those benefits from the Professional Firefighters Association. I like the genetic testing. I like those things. I'm willing to pay the extra amount. Is there a wrong answer up here? The answer is no. So people, and especially the cops, they call me all the time, hey, I'm retiring in 3 weeks, walk me through my benefits. So, you know, I've got this little thing that I put together, and they go, but which one should I take? What do you want? You know, what's important? I can't answer that for you, okay? Do you want to take a little bit financial risk off the table and enroll in a lower premium plan? Do you want the lowest premium plan because you're willing to take the added burden if it's, you know, higher? Do not call me because I'm in meetings. I am constantly, this time of year between now and, you know, December 15th, it is everything I can just to do things. We can answer and address and do most everything through email. I can answer your email at 4 a.m. I can't call you. My Medicare meetings for people aging in, okay, they take time. Those have to be done via Zoom, all right? So we do those, we have to meet certain things that we have to do. I'm in those meetings a lot. I don't have time. Literally, at the end of the day, I'm looking at my phone and I've got 23 voicemails and it's 6 o'clock at night. So I can't return all of those calls. We try to text people and say, can you email us and stuff? So all I'm asking for, we're gonna help you. We're gonna get you all the information you need. I promise. We have people to help. We have people to do it. But please email me.
I'd like the overview that we're going to be doing today. One of the key things that I want to tell folks, this is a really important meeting and really important information this year. The City of Phoenix active retiree healthcare plan and the retiree healthcare plan are self-funded, which means the City of Phoenix, we control all of those expenses. We take premiums in from the active members. The city kicks in 80% for active members. Retirees have to pay the full freight. And those expenses are paid out of there. Then we pay a network, which is United Healthcare on the retiree side, to manage those claims. On the retiree side, we've been hit really, really hard. It's a citywide plan, so it's not just a firefighter plan. There's just over 1,100 City of Phoenix employees in it, and we've been really hit really hard with medical expenses. And so the plan essentially is in a nosedive, is probably the best way that I'm going to tell you, for the City of Phoenix non-Medicare retiree. This is non-Medicare only, so anybody in here under age 65, and you may be on this plan, this is what I'm going to focus on right now, because we have some great options for you to save a lot of money for retiree healthcare on the non-Medicare side. But the big thing I want to tell you about on the City of Phoenix non-Medicare healthcare side is that this year, starting on January 1st, there's going to be a 17% increase in premium across the board. There's going to be no benefit plan design change, meaning your deductible's not changing, your prescription meds deductible and cost is not changing. What's going to change is that premium. So we could have done a number of different things to try to mitigate that increase, but it was going to be bad all the way around. The big problem is we have a lot of unhealthy people across the city that are in that non-Medicare healthcare plan. It's killing the plan from an expense standpoint. So two things need to happen. One, the city kicks in more money, okay, to the plan. And we've been using a rate stabilization fund that was put in place back in 2007. We're exhausting it this year by keeping the premiums down. It's gone. So the city's forced to put more money in the plan, which at this point, that doesn't seem to be happening. The other way you sustain the plan is by increasing premiums to participants in the plan. So that's the only option that's really left here. So for this January 1st, the premiums are going to go up 17%. January 1st next year, they're going to go up 13%. That's 30% over 2 years. It's ridiculous. It is completely unsustainable. And I'm just going to give you some numbers here. Okay, for those in the United Healthcare Choice HSA, for a retiree spouse, it's going to go up in this year, next year, a total of $630. Unsustainable. If you're in the Choice PPO, it's going to go up $500 total between this year's increase and next year. If you're in the catastrophic plan, it's going to go up $530 between this year and next year. And if you're in the Navigate HMO, it's going to go up $700, okay? The good thing is there's light at the end of the tunnel when you turn 65, because we've negotiated some subsidies for local 493 Unit 5 members. Unfortunately, there are subsidies for the chief officers, but they're reduced. The chief officer local chapter is working on, Wes Patterson's working, and I'm helping him try to get those subsidies upped on the Medicare side for the chiefs, but for right now, it's a little bit lower than what we have for actives, and we'll cover those subsidies a little bit later on. But once you get to Medicare, it's pretty clear sailing. You know, your costs drop dramatically. You know, the subsidies we got, they're phenomenal. And Kenny Timms will talk about, you know, what we really have at the end as far as that. But the non-Medicare healthcare folks under age 65, that's a real expensive way to go, the City of Phoenix healthcare plan. So we're going to provide you with some options here a little bit later on. Kenny Timms has come across a plan called the Thin Blue, from an association called the Thin Blue Line. It specializes in retired police officers and firefighters across the country, and uses the Cigna network with very reasonable premiums, and you can also use your subsidies both from the state and the city and the local to help cover that cost, and he'll cover those premiums here a little bit later on. We also have another option through the state of Arizona. If you're a retired union member, through the Professional Firefighters of Arizona, we've created a retiree healthcare program that's a little bit more in premium, but it's insured here by Blue Cross here in Arizona, so it's a good plan as well. Then you also still always have the Arizona State Retirement System plan, and then the City of Phoenix plan. A lot of folks came back to the City of Phoenix plan because the ASRS non-Medicare plan became really expensive. So really, you know, now it's those two are. I'm not even having ASRS present here this year just because of the cost and what they have.
Thank you. So I am with the City of Phoenix, like Brian said, so I'm going to be going over just a quick overview of some information and then a little bit more about the subsidy. So you City of Phoenix retirees have a wonderful benefits staff that is available to you to answer your questions, and you can always call us about subsidy stuff, healthcare things. You know, always reach out to us if you have any questions or concerns. We offer coverage with United Healthcare for both pre-Medicare and Medicare plans. Our dental coverage is through Cigna. And here are our premiums for our MERP retirees. Now, these premiums do not include your MERP money that you may be receiving or the state subsidy. So these are just the flat premiums before any additional MERP or subsidy is received.
The plan, people are probably going, you know, what's happening with the city plan? It's the number of healthy people in the plan. We're down to 800 members in the non-Medicare retiree healthcare plan. There used to be thousands, but it gradually, you know, reduced over time. And now we're at a point where I've been saying for a few years, if you might have heard me, that it was in a nosedive. It was an auger into the ground at some point, just because there weren't enough premiums coming in to pay expenses. And the city did not want to supplement it, put money into it, because most typical health insurance plans are, you know, they exist because there's an employee contribution and an employer contribution. But in this particular case, folks went elsewhere to get more affordable coverage, and those are the healthy people. So it's coming to an end. If you're in it, you might want to think about
other plans. I don't think we had that many people in it because we had about 400 people that left the plan last year when the thin blue line came along. I think a lot of those were our members. Okay, I want to cover briefly another option that exists out there. The Professional Firefighters of Arizona, that's our state union. We have one official health care plan with the Professional Firefighters of Arizona. It's a medical and dental coverage through the United Arizona Firefighters Healthcare Trust, through Blue Shield of Arizona and MetLife, that's medical and dental coverage. If you're retired IAFF member in good standing with your local, you're eligible, for individual or family coverage through this particular plan. When you look at a healthcare plan, there's a couple things you ought to consider. Cost and value. Okay, can you find really, really low cost health insurance? Yeah, but what's the value there? Are you going to be able to reach somebody? Are you going to be, stuck communicating with, somebody in a call center overseas? A whole bunch of issues come into play, timely payment of claims and so forth. But the PFFA healthcare plan was created a few years ago for those entities across the state that didn't have any kind of retiree healthcare coverage. City of Phoenix, we've been really fortunate. One of the other things is that you're also able to get the subsidy, applied to that. That was before we were able to work out the system that we have here in Phoenix. But it's a good plan. It's covered through Blue Cross Blue Shield of Arizona. And one of the big benefits of that is that we have relationship with executives and CEO folks at Blue Cross of Arizona. So when we have an issue, we can call them up just as we do with our City of Phoenix plan. So that's one of the big advantages of that. To get the premium information and so forth, that's available on the PFFA website, or you can call the head of the trust, Don Youngward, who's also president of the Professional Firefighters of Arizona. But also just want to make sure everybody in here, you're aware of that plan. We talked about it last year. Don made a presentation. He's out of the country right now on a short family trip. But that is certainly another option that's available to you as well. Just want to bring that up. So with that, I think it's time to go into the Kenny Tim show, which is, and we're just about on schedule. It was supposed to be 10:45 Kenny Tim, so I think I brought us back, which is a good thing.
So with that, I'd like to introduce Desiree Pompa, if she wouldn't mind coming up right now. Desiree works in the City of Phoenix HR office, so she's going to do a couple things here. Number one, she's going to talk about the downward spiraling City of Phoenix retiree healthcare plan, which is eventually going to be a closed plan. So if you're in it right now, you want to start making some changes to get out of it. Most of our members got out of it because they were premium oriented, meaning they wanted lower premiums, and because it's a self-funded plan. And you need healthy people in the plan. The retiree healthy population has gone down, and the unhealthy people stayed within the plan, so that's why it's got more expensive. So that is eventually going to go away between now and the end of 2025, so she's going to talk about that. And most importantly, she's going to talk about the healthcare premium subsidy and some of the things that I spoke of before. So please welcome Desiree Pompa.
Okay. So I'm Desiree Pompa. I've been with City Benefits for about 2 years now. I've been with the City of Phoenix overall for almost 5 years. And I've learned a lot in my 2 years at Benefits. I specifically for the benefits team handle the subsidy payments that go in your MERP check. So if you get subsidy through your pension check, you may not talk to me, but if you get in your MERP check, you've probably talked to me, especially with the last renewal. It was me and Paula kind of tag teaming that. Paula is still with the benefits team, so if you know her, she's still around. You can always call her as well. So today we are going to talk about just the retiree benefits program for the City of Phoenix. Like Brian mentioned, not a lot of you are in it because we did establish some hard rules in 2024. I'll go over those rules again. But if you are on our dental or vision or even our non-Medicare plans, this will pertain to you. Obviously, throughout your retirement, the City Benefits Office is still here for you. So if you ever have any questions or if you're confused by anything or you can't get a hold of PSPRS and you need our help, you can always call us. Healthcare premiums for our insurances are automatically taken out of your pension check. There is not an option for direct pay. And also, obviously, there's automatic eligibility for the HELPS Act and for the state subsidy program. So I have 2 slides on our changes for this year. I will read these verbatim, so please bear with me. But as recommended by the Healthcare Benefits Trust Board and adopted by the city, effective January 1st of 2024, if you are not enrolled in a city retiree health plan, you will not be able to enroll or re-enroll in the city's health plans. So there's that hard door. If you're not in, you're out, and you're out forever.
Tell everybody that's new, because
That is new as of this year. So prior to that, you could come in, go out, you could drop at any time. We did not have a rule on it. So as of this year, you had to be, as of January 1st, you had to be in the plan, and then you're in for as long as you want. Otherwise, you are out and you cannot come back into the plan. This change applies to dental, vision, and non-Medicare medical plans individually. So if you were to drop dental, but you kept vision, you can stay in your vision. You don't have to drop both. Okay, they're all individual. And again, non-Medicare medical plans. So if you have a United Healthcare AARP Medicare supplement attached to your pension with us, that is fine. That is not affected by these changes. Also, as of January 1st, 2024, retirees will have 31 days from the end of their active city employment health coverage or the end of their city COBRA coverage to elect and submit payment for medical and dental vision coverages with the city. If elections are not made within 31 days, the retiree will be unable to enroll in the city's retiree health plans in the future. So if you are a brand new retiree or you're coming off of COBRA, you have a 31-day deadline. And again, that's as of this year that we instilled that rule. And then, effective December 31st, 2025 or sooner, the non-Medicare medical plans will no longer be available as of December 31st, 2025. It will end sooner if the plan is unable to procure reinsurance, also called stop-loss insurance, and or enrollment falls below a threshold where costs are no longer sustainable, in which case the plans would end sooner. This does not affect the available Medicare plans or the city retiree dental and vision. So just the non-Medicare medical plans that we have with United Healthcare, just not Medicare supplement. What was that?
How many people are in that group?
Not a lot.
like 500
Yeah.
is
We-
non-Medicare healthcare plan.
That's across all employees of the city.
City.
Yep. Public safety, general city. Yep. The closer to our sunset date of December 31st, 2025, the city will partner with benefit consultants and insurance carrier to offer education and trainings regarding navigating enrollment in a non-Medicare plan offered through the federal marketplace. So we will have some resources. That is currently what our office is working on gathering all of that material. 500 people is still a lot of our retirees. We are a small team of about 15 to 20 people, so we are going to have a robust team of experts to help us and help you. If the retiree has insufficient pension for premium deductions, medical can be direct payment to the city. City dental and vision, though, will continue to be taken out of your pension check. So once I show you the premiums in a couple slides, you'll understand what I mean by that insufficient pension. Our non-Medicare UHC plans, we have the 4, the Navigate HMO, the Catastrophic, the Choice HSA, and the Choice PPO. If you are receiving 202 MERP on the 1st of each month, these would be the premiums that our non-Medicare retirees would pay. So they did increase significantly. The premiums are reduced by the qualified city contribution. And then to get your net cost, please deduct your MERP, so your 202, and then your subsidy. That would also be deducted.
Sometimes we hear from retirees that, like, why don't we have 100% health care if I can retire, paid health care with all deductibles paid, all co-pays paid, and completely free for my spouse and my young children. Well, we've never been able to do that. We have a couple of retirees out there, younger retirees that think that if you retire with just 20 years of service, you should get fully paid medical benefits for yourself and your family. There's been some attention drawn to MESA and those benefits, where we don't see that happening with the city of Phoenix, because the city of Phoenix is much larger, has much larger costs. We have a pension deficit and so forth that the city's paying down.
Brought up earlier about our benefits package. I will tell you, I don't know if we're ever going to be not in first place in that category, because there's not one city that is willing to put $2 billion up to have their employees have medical coverage for life. There's just not. There's not any in this state, and we can hardly find any in the country. That is a huge investment that your city has made into you and your future. And if you haven't calculated that investment is well worth waiting